This occupation includes people who should have a background of medical terminology, pharmacology, and the medical legal aspects to correctly capture patient information from the beginning, and also look at how this record is stored at the facility and disseminated without violating the privacy rules. What we actually do in the health facilities, apart from just collecting the information, the health ministry is having the National Health Data Bank, which is running, and the data which comes from the various health facilities is taken to the decision makers through the DHIS2 system, where reports are generated and given routinely to monitor and evaluate the health sector strategic investment plan indicators, which actually helps the decision makers and planners at ministry level and even at local levels to allocate resources, and even including things of human resource, and also you see today the result-based financing, where money is allocated on how someone has performed. So this is what the medical records does. Another challenge that is still faced by this profession in Uganda is the issue of the motivation. We did have an industrial action last year from 1st of April, which was mainly about the discrimination in the salaries. As the other health workers were enhanced, actually the medical records professionals were left out, and yet this role they take is really at the center of the healthcare system, where they have to integrate between the doctor and even the patient themselves, and so that the patient receive the care that is really appropriate. So the issue of motivation is still pending. However, we had the engagements with relevant ministries, and actually the talks are ongoing to have this sorted, but only that the process is really being delayed, which is what we really hope will come out clearly in the near future. One of it is that the allied health professionals has come on board, and the schemes of service, which is a document which actually regulates how someone can grow within the profession. So the scheme of service, the draft has been done with the help of the BUMECA, which is the association regulating the medical records professionals in Uganda, and also with the help of other stakeholders, including the Allied Health Professional Council and the Ministry of Health. The draft is already there, but we are waiting for the final approval of that scheme of service from Ministry of Public Service, so that we can have someone grow in this profession from the lowest level to a level which is at policy level. The challenge is we see the stakeholders, sometimes there is lack of concrete information from the grassroots level on understanding the roles of these various professions. I should let you know, when you go to the community and ask someone to explain who actually works in the hospital, they are going to tell you only two. They are going to talk about a nurse and they will talk about a doctor. But behind this, there's a lot. We have the allied health professionals, where the medical records professionals actually lie, and there are many other cadres involved there, about 36. So the challenge has been that there has been no much in-depth analysis of the contribution of each of these professionals, specifically the medical records, so that the policymakers would actually prioritize the issues relating to the profession, including the motivation, like the remuneration. So the challenge is really just gathering as much information as possible to inform our policymakers holistically about what actually the medical records do at the facility levels.